So the topic of discussion is peritoneal space and sacs. So under this topic we will be talking about the different sacs and spaces present in peritoneal cavity, right? Okay, now before getting into this topic, I would like to take you toward this diagram. Now what this diagram denotes, okay, this diagram denotes the earlier phase, or the phase in which there is the developmental process going on. So at this time what will happen is, as you can see, what is this? This is our liver, this is our stomach, and this is our spleen, right? The liver is facing toward anterior abdominal wall, whereas the spleen is facing toward posterior abdominal wall. So if you remember the lecture on the layer of anterior abdominal wall, at that time we discussed about what? There is ligament that will connect liver to what? Anterior abdominal wall, and this ligament is called Felsiform ligament, right? Okay, now this liver along with hepatic potis, right, this will be connected to what? The lesser curvature of stomach with the help of what? Lesser omentum, right? The liver is connected to lesser curvature of stomach with the help of lesser omentum. Similarly, this is stomach, and since this is the lesser curvature of stomach, this is what? This is the larger curvature of stomach. So right here, the larger curvature or the greater curvature of stomach is connected to spleen with the help of what? With the help of our with the help of what? With the help of greater omentum, right? Okay, similarly this spleen, right, here is the spleen is connected to our this dorsal, right, dorsal body wall, right? We have got ligaments right here. The ligaments are, what are the ligaments? The gastrosplenic ligament, right? Okay, and this gastrosplenic ligament is right here, whereas our spleen, when connected to kidney, right, to posterior abdominal wall, at the time we have splenorenal ligament. Okay, these are the things. So the initially, what is the condition? That initially our, what is going on is, initially our this what is this? Initially the lesser curvature, right, lesser curvature of stomach, let us suppose this is the lesser curvature of stomach. The lesser curvature of stomach is facing anteriorly, right, and the greater curvature of stomach is facing posteriorly, right? Okay, now as we have said, the lesser curvature is facing anteriorly and the greater curvature is facing posteriorly, and anteriorly, that means there is the presence of what? Ventral mesentery, right? In that ventral mesentery we already discussed, right? This is what? This is our anterior abdominal wall, right? And this is all our what? This is all our ventral mesentery, right? In this ventral mesentery, what is developing? The liver is developing, right? Ventral mesentery. Okay, and posteriorly what we have? We have what? We have greater what we have is posteriorly we have greater curvature of stomach, and posteriorly we have what? We have dorsal mesentery, and in this dorsal mesentery what is developing? Our spleen is developing. Okay, now during the course of development, right, this our stomach will rotate. That is what? During the time of gut rotation, our stomach rotates, and this structure, this lesser curvature which is facing anteriorly, will move 90 degree. As it moves 90 degree, obviously the lesser curvature and the liver which was developing in this region will face what? It will face the right angle. It will turn right angle and it will move toward right side. So our lesser curvature and liver, these are the structure on what? On right hand side. Similarly, the greater curvature and spleen, right, which were here, which were posteriorly, they are what? Moving toward the left side. Okay, that means in this diagram it was shown the early phase, and in this diagram, as you can see, right, what is going on? There is 90 degree rotation. As there is 90 degree rotation, the liver will move toward what? Right hand side, from anterior to right hand side, right? Lesser curvature will move toward right hand side, whereas the spleen, right, and every ligaments that it contains, right, these all will move toward what? This will move toward left hand side. Okay. Okay, now moving further. Okay, during this time, if you see, during the time of 90 degree rotation, what is going on is, there is certain space which is being created, right? There is space which is being created, and the space on right hand side of the space on right hand side of stomach, right? The right hand side of stomach. Now what it will be called? It will be called Omental Bursa. or it can be also called lesser sac. Okay, anteriorly there was lesser curvature, right? Anteriorly there was liver, and anteriorly there were some of these spaces, and during the time of 90-degree rotation toward right side, these spaces along with liver, the ligaments, they will move toward what? Right hand side. So the space on the right hand side of stomach, right hand side of stomach, they will be now what? They will be called what? They will be called Omental Bursa. Okay, what I said is the space on right hand side of stomach goes behind the stomach, forming lesser sac, right? It is on the right hand side, but right hand side behind the stomach, right? Behind the stomach, close to posterior abdominal wall. Okay, now except this space, all other space, they are called what? They are called greater sac. So this is the lesser sac or omental bursa, and remaining all other, they are called what? Greater sac. Okay, now since this is what? This is lesser sac or omental bursa, and other all structure are what? The other all structure are greater sac. There might be communication between lesser sac and greater sac. Now what is that communication called? That communication is called, here is one communication, and that communication is called Epiploic Foramen of Winslow. What I am saying? Epiploic Foramen of Winslow. This is the what? Foramen, or the communication between greater sac and lesser sac. Now, why is this important? I mean, why is the Epiploic Foramen of Winslow so important? The Epiploic Foramen of Winslow is important because during the time of perforation of stomach, right, because of ulcer or something, the stomach will be perforating, right? The stomach, the content of stomach will reach in this omental bursa, right? And when there will be what? Our gut content or stomach content in omental bursa, from this omental bursa we need to what? We need to aspirate our what? The gastric contents. So while aspirating these gastric content, we have to aspirate it through what? This. What is this? Epiploic Foramen of Winslow. So it is important. Okay. Simply, during posterior perforation of stomach, I mean posterior, because of some disorder, there will be posterior perforation of stomach, and the gastric content will be in omental bursa, right? It will be an omental bursa. So from this omental bursa, in order to pull it out or to aspirate, we need to aspirate it through what? Epiploic Foramen of Winslow. That's all. So now I would like to take you toward another condition. Okay, now in this diagram, before getting into this diagram, I would like to take you toward one important thing, and that thing is, okay, let us suppose there is one patient who was a computer operator, right? Okay, now that patient is having severe epigastric pain. That patient is having severe epigastric pain. Now she is taken to immediate surgical exploration, right, which reveals the evidence of ruptured gastric ulcer, right? What is going on is, there was one computer operator, she came to hospital, and she was immediately taken to emergency department, right? Now now on doing surgical exploration, there was found that she is having evidence of ruptured gastric ulcer. Now the surgeon will found the stomach, the content of stomach, in which region? Obviously, in which region you will find? You will find in the region of what? Lesser sac or omental bursa. That's all. Okay, lesser sac and omental bursa. Now here it will found. Now what is going on is, now the doctor, right? The doctor says that patient, doctor says that person to lay down, right? Doctor says that person to lay down. Now at the time of laying, right, in supine position, now that gastric content will move into which region? Okay, in a patient in supine position, that means in this position, right, post operatively, I mean operation is not done yet, right, the gastric content or the pus is found, right? It is found in which position? I mean, what is the dependent location in supine position? The pus is found in which location? The pus found in this position is, the pus is found in hepatorenal pouch. Hepatorenal pouch, or we can say hepatorenal pouch of Morrison. Right? Hepatorenal pouch of Morrison. Okay. Now, what about when we say that portion to stand, right? To erect, I mean to stand erect. Okay, at the time of erect, the most dependent location in erect position, right? The most position. Now what is going on is, from this, what is this? Hepatorenal pouch of Morrison, the pus will move downward and it will be collected in this region. Now what is this region called? This is called rectouterine pouch or pouch of Douglas, right? Pouch of Douglas. So we studied two things, right? Computer operator came to us, we examined, we found that there was what? There was a gastric ulcer perforation, right? That gastric ulcer perforation or that gastric content will be found in lesser omentum. So it will be found in lesser sac, sorry, not lesser omentum, lesser sac, or we can say omental bursa, right? Okay. Now when we said that portion to lay down, we found that pus or that gastric content to be in what? To be in hepatorenal pouch of Morrison. Right? Or we can say the dominant position or dominant place of collection of pus in supine position is what? Hepatorenal pouch of Morrison. Similarly, we tell that portion to stand, right? Now that from that hepatorenal pouch of Morrison, the pus will get accumulated in this region. What is this region called? It is called rectouterine pouch or pouch of Douglas, right? Okay. Now after this, I mean after this region, right? This region, the rectouterine pouch, right? Now this region is called what? This region is called what? Pelvic region. So it is also called what? Pelvic abscesses. What is it called? It is called pelvic abscesses. Now this pelvic abscesses in female is removed transvaginally, right? Transvaginally. But in the case of male, it is drained rectally. So now what is going on? We told patient to stand erect. Now this pus is right here. Now from here we are removing through what? Transvaginally in the case of female, transrectally in the case of male. Okay, this was all about this thing. Okay, now what I'm saying is the lesser omental bursa or lesser sac, right? Omental bursa or lesser sac. Okay, what we said? Omental bursa or lesser sac, right? In the omental bursa or lesser sac, at the time of 90-degree rotation of stomach, right, there are the sac or space which are behind the stomach on right side, and they are called what? They are called lesser sac or omental bursa, right? It is also called left hepatic space, left subhepatic space. Now why it is called left subhepatic space, we'll know it later on. But now, okay, now what about, okay, before getting into this diagram, let us okay, what does greater sac include, right? What does greater sac include? Okay, as we said in these two diagram, from what epiploic foramen of Winslow helped in pulling out the gastric content from what? From lesser sac to the greater sac. Now obviously these structures, the hepatorenal pouch of Morrison and our rectouterine pouch or pouch of Douglas, these are what? These are the structures of greater sac, right? We brought our pus or gastric content from what? Lesser sac to greater sac. Okay, that means greater sac includes what? Greater sac includes our hepatorenal pouch of Morrison and our rectouterine pouch or pouch of Douglas. That's all. Okay, now getting here, we need to know a detail about epiploic foramen of Winslow, or we can say right here, this is what? Epiploic foramen. Okay, what is this structure? This structure is the sagittal section of body, right? Sagittal section right here, sagittal section, and we are having side view. So while looking from side, we have this structure, right? What is this? This is our what? Liver, right? Here you can see coronary ligament, right? That is attaching liver to body wall superiorly, right? This is our liver and this is our stomach, right? Stomach and liver, they are connected, right? The liver is connected to the lesser curvature of stomach with the help of what? With the help of lesser omentum, right? Now here, right here, you can see, what you can see is we have this foramen, right here. This is our foramen, right? This is our foramen. What is this foramen? This is the epiploic foramen of Winslow, right? Now the structure that is shown in blue color, right, sky blue color, this structure, what is this? This is all our lesser sac. What is this? This is all our lesser sac. And the remaining structure, right, in pink, whatever is shown in pink, what is this pink structure? This all pink structure is our what? Greater sac. This everything is our greater sac. And as we have already mentioned earlier, the lesser sac, so the lesser sac and greater sac are what? Communicated through what? Epiploic foramen of Winslow. So now we will look in detail about what? This epiploic foramen of Winslow. Now looking in detail about epiploic foramen of Winslow, we need to know about the anterior boundary, superior boundary, inferior boundary, right, posterior boundary. Now let us move toward this thing. So here talking about the anterior boundary. What? Anterior boundary. Anterior boundaries, right? Talking about the anterior boundary, right? If you look it carefully, you will see that anterior boundary is simply nothing but it is the structure that is connecting lesser sac and liver. Now what is the structure that is connecting lesser sac and liver? The structure is our lesser omentum, right? Lesser omentum. So this is what? This is our lesser omentum. So it is the anterior boundary. Now this lesser omentum, it contains what? It contains different structure within it. Now what are the structures within it? The structures are bile duct, hepatic artery and hepatic vein. So the anterior boundary, what we can say is the anterior boundary is what? The anterior boundary is our lesser omentum, right? Lesser omentum that contains what? That contains our DAV structures. Now what is this D? This is bile duct. What is this A? It is hepatic artery. And what is this V? It is portal vein. So these are what? These are the anterior boundary. So anterior boundary is nothing but right here. It is right here, anterior boundary. Now what about the posterior boundary? And if you look the posterior boundary, the posterior boundary is our T-tubal vertebra. T-tubal vertebra, and also we have what? We have inferior vena cava, right? Inferior vena cava, somewhat right here. Inferior vena cava. This is our T-tubal vertebra, and here we have what? Inferior vena cava, right? And as you can see, there will be what? The posterior boundary will be what? The posterior boundary will be our right suprarenal gland, right? Suprarenal gland. Okay. Let us move to our more magnified image. We are talking about this. This is our anterior boundary, right? We will be talking about posterior boundary now. Okay. Now the same diagram, it is what? It is magnified. Okay. Here, what is this? This is our lesser sac. The structure right here is our lesser sac. The outward this structure, everything is what? The greater sac, and right, greater sac. So here the structure that is communicating lesser sac and greater sac, what is that? That is epiploic foramen of Winslow, right? We are looking the boundaries of epiploic foramen of Winslow. What is this? This is our anterior boundary, right? This is our anterior boundary. What is this? This is our posterior boundary. This is our posterior. What is this? Superior boundary, right? Superior boundary. What is this? This is our inferior boundary, right? Inferior boundary. So we talked about what? Anterior boundary. Talking about anterior boundary, what we have is, we said that Omental Bursa. Talking about the anterior boundary, we said that lesser omentum, right? Lesser omentum will form anterior boundary, and lesser omentum consists of what? Lesser omentum consists of our what? Our bile duct, right? Our bile duct, our what? Hepatic artery, and we have what? Portal vein, right? These are the structures that will make the anterior boundary. Now what about the posterior border? Posterior border. Talking about posterior border, we said that T-tubal vertebra will make that posterior boundary. Along with T-tubal, we have what? Inferior vena cava. We have inferior vena cava, and we have right suprarenal gland. Now these structures are what? These structures are posterior boundary. What are these? Posterior boundary. Posterior boundary. Okay, now moving further, what we have is we have superior boundary. And what is the superior boundary? The superior boundary is caudate lobe, caudate process of caudate lobe of liver. We can say the caudate lobe of liver is the superior boundary, right? Caudate lobe. What is the caudate lobe? It is the first segment, or we can, it is also called third surgical liver, right? Okay, those things. Now what about the inferior boundary? Inferior boundary is our first part of duodenum. What is the inferior boundary? We have first part of duodenum. Okay, now now if you look it so carefully, what we can see here is, okay, what we can see here is our this structure, right? This is what, this is what, this is all our what? Lesser sac. And the lesser sac consists of what? This is what? This is all our what? This is all, what is this? Our, this is our what? Epiploic foramen of Winslow. If you look it carefully, you will find that this epiploic foramen of Winslow is sandwiched between our these two veins. What are these two veins? One is the portal vein and another is inferior vena cava, right? That's all. Okay, now spleen. Now spleen. Now if you remember our spleen, what is going on is our spleen is, okay, this spleen is, right, it is present in greater sac, right? It is present in greater sac and it is kept in that greater sac, or it is held in that position with the help of gastrosplenic, that means present right here, gastro, stomach and spleen, gastrosplenic ligament. And another posteriorly what we have is splenorenal ligament, right? Spleen is present in greater sac, right? It is kept in, it is in that greater sac and it is held in that position with the help of ligaments. And the ligament are, one is the gastro what? Splenic ligament, right? The one that connects the greater curvature to our what? To our spleen. And the another structure is the spleen and what? The posterior abdominal wall, and that is done by our splenorenal ligament, right? There is kidney present posteriorly, so it is splenorenal ligament. So and you know, and we have discussed this thing, okay, these things somewhere before, that splenic artery branches to greater curvature, right? Splenic artery branches to greater curvature, and this is carried by gastrosplenic ligament, or we can say that gastrosplenic ligament consists of what? Splenic artery, right? Gastrosplenic ligament, that means here consists of what? It consists of our splenic artery, and that splenic artery will supply the greater curvature of stomach. So that's all. Now what about our now talking something about lesser omentum. Yes, we have already said what is this. This is all our, this is the structure of our lesser omentum, right? Lesser omentum. What lesser omentum is doing? Lesser omentum is forming the anterior wall of our what? Epiploic foramen of Winslow. And this our what? This our lesser omentum is what? This is the what? The connecting structure between what? Connecting structure between our liver and liver, specifically what? The liver and lesser curvature of stomach. So this our lesser omentum has two part, right? The lesser omentum has two part. Talking specifically what? This is our lesser omentum, right? Okay, you can see right here lesser omentum have two part, and the two part of lesser omentum are, this whole is our lesser omentum, right? Lesser omentum. Now two part of lesser omentum is, one is hepatogastric ligament, right? Hepatogastric, liver and stomach, hepatogastric ligament, and another is hepatodurinal ligament, hepato, liver and duodenum, right? Hepatodurinal ligament. And this hepatodurinal ligament, right, is the specific point which contains our DAV structure. That means this structure that we discussed right here, okay, these, right? DAV structures. These DAV structures are, we say that these DAV structures are present in lesser omentum, right? And it's talking specifically in lesser omentum, these DAV structures are present in hepatodurinal ligament. So Hepatodurinal ligament. Okay, hepatodurinal ligament consists of what? Okay, hepatodurinal ligament consists of what? DAV structures that are carried to porta hepatis, right? Okay, now as it is clear that what is this? This is what? This is our what? This is our artery and this is our duct. So we can say that duct is present right side of what? Our this artery. Okay, or we can say the artery is what? It is present left side to our what? This duct, right? The artery is somewhat in middle line, but the duct is somewhat in what? Somewhat in our right side. So now all the thing that we have discussed right now, right? We would like to discuss it through this diagrammatic representation. Don't get confused. What is this? This is our liver, right? Liver, the right side of liver and the left side of liver, right? This is our liver. Now this is what? This is our, what is this? This is our gut, and this gut, what we have is, we have stomach, right? This is stomach, right? Stomach. And in this stomach, what we have is, we have this lesser sac. Behind this stomach, I mean behind stomach, posteriorly we have lesser sac, right? Now this stomach and the liver is being connected by what? Ligament. And we said that this stomach and liver, it is connected by what? Omental. It is connected by lesser omentum. What is this? This is all lesser omentum. And we say that lesser omentum has two ligaments. One is what? Hepatogastric ligament. One is hepatogastric ligament and another is our hepatodurinal ligament, right? Hepatodurinal ligament. And we said that hepatodurinal ligament is the structure that consists of DAV structures. Okay, now you can see the green one, the hepatogastric ligament, right? And the red one, hepatodurinal ligament, right? And we said that hepatodurinal ligament consists of free margin DAV structures. Duct, hepatic. What are the DAV structures? Bile duct, A is hepatic artery, V is portal vein. Okay, now as we said, right, as we said, now here what is going on is, as we can see, this is what? This is D1 or first duodenum, right? It is connected to liver by what? Hepatodurinal ligament. Now moving further, now here is our lesser sac, or posterior to our stomach, or stomach is our lesser sac, and this lesser sac is what? Is connected to our greater sac. All other structures, right, all other spaces except our lesser sac is our greater sac. So this is connected to greater sac with the help of what? Epiploic foramen of Winslow, right? Now what is this? This is our epiploic foramen of Winslow. Okay, epiploic foramen of Winslow. So here the epiploic foramen of Winslow. Okay, now what we said, okay, the same case, there is computer operator came to us. Now she is saying she is saying that she is having pain in epigastric region, right? On examination we find there is posterior stomach perforation, and because of that posterior stomach perforation, the gastric content or pus are found in where? The gastric content or pus are found in lesser sac or omental bursa. Now from that omental bursa or lesser sac, we need to pull every content outside. Now we will pull it through what? Epiploic foramen of Winslow. Now that epiploic foramen of Winslow, what is going on is that epiploic foramen of Winslow will, while on supine position, the epiploic foramen of Winslow will what? It will bring that the pus, right, the gastric pus into what? Into hepatorenal pouch of Morrison, right? Now we say the patient to stand. Now that while standing, right, while standing, it is carried to where? Recto-uterine pouch or pouch of Douglas, right? Okay, now it will reach to what? Recto-uterine pouch or pouch of Douglas with the help of what? This right paracolic gutter. I mean through right paracolic gutter it will reach there. In what? In pelvic region. Now that will be formed as pelvic pus, and it will be removed transvaginally in the case of what? In the case of female, transrectally in the case of male. And this what is this? Removing, right, our pelvic abscess, right, by putting by putting fornix by opening the posterior of vagina, right? What is going on is now we are removing pelvic abscess, right? Pelvic abscess. Okay, as we have said, it is removed transvaginally in the case of female. Okay, now how it is done is, now pelvic abscess is drained by putting opening, right? Pelvic abscess is drained by opening, or just by opening, by putting some of the hole, we can say opening, right, in the posterior fornix of vagina, right? Posterior fornix of vagina. Now this process is called colpotomy. What is called? It is called colpotomy. So what is going on is, the patient was there from epiploic foramen of Winslow. We just pulled out what? Pus. Now it is in supine position. It is in where it is? It is in hepatorenal, right? It is in hepatorenal region, pouch of Mauritian. Now while in supine position, through this right paracolic gutter, it will just drain down, right? It will come in a region of what? The pouch of Douglas, right? Now there will be pelvic abscess. Now that pelvic abscess will be drained. How it will be drained? It will be drained by putting some of the opening in posterior fornix of vagina. Now this process is called colpotomy, right? This is what we studied. Okay, now moving further, if you just watch it carefully, what we have is, we have written here this is what? This is hepatorenal pouch. Hepatorenal pouch, right? Hepatorenal pouch. The most predominant position, right, of collection of pus at the time of supine position. Okay, this hepatorenal pouch, it is also called a right subhepatic space. Why it is called a right subhepatic space? Because you can see, what is this? This is our liver, and the liver, this is our right side, right lobe of liver. So this space is present on the right side, and it is present beneath our liver, right, behind liver. So it is right subhepatic space, right, right subhepatic space. And if you remember the lesser sac, I called lesser sac as what? It as left subhepatic space, right? Why I called it as left subhepatic space? I called it left subhepatic space because what is going on is, it is present on the left hand side. Where it is present? It is present on the left hand side, right, left lobe, toward the left lobe, and it is present behind the liver. That's why it is called what? Left subhepatic space. So there are two. One is left subhepatic space, that is also called lesser sac or omental bursa, and another is right subhepatic space, and it is what? It is also called hepatorenal pouch. Why hepato and renal? Because there is presence of boundary of kidney also above. So okay, this thing is clear right here. This thing is clear somewhere right here. Okay, right here you can see, right? What you can see is this 2 and 4 structure. What are these 2 and 4 structures? This 2 is left subhepatic space. What I'm saying, left subhepatic space. Now what is this left subhepatic space? It is lesser sac, obviously, right? Lesser sac, or we can say it as a omental bursa. And what is this fourth structure? This fourth structure is our hepatorenal pouch of Mauritian. And what is this hepatorenal pouch of Mauritian? It is a right subhepatic space, right? Right subhepatic space. So from this lesser sac to our right subhepatic space or hepatorenal pouch of Mauritian, right? There will be what? There will be the pathway for pus drainage. And this structure, what is this? This is obviously our what? Epiploic foramen of Winslow, right? Okay, since there is what? There is our liver right here, right? And below that liver, these all are the structures, so it is called subhepatic spaces. Okay, now another thing that we need to know is, okay, it is the same thing, right? This is the same thing. As you can see, what is going on? This is our liver, right? The same thing. It's the same thing, the same computer operator and the movement of pus. What is this? This is our liver, right? Liver, as you can see, there is what? This is what? This is our lesser sac. What is this? This is our lesser sac. Now this lesser sac, from this lesser sac the gut content are moving outward to into the greater sac, or we can say into this space. What is this space? This space is right subhepatic space or hepatorenal pouch of Morrison. Now what is this? What is this? This is obviously what? Our epiploic foramen of Winslow, right? And what is this? This is already I have mentioned, right subhepatic space or hepatorenal pouch of Morrison, right? Okay, now through this from this right subhepatic space the gut content will move downward, and this what is this called? What is this called? This is called a right paracolic gutter. Right paracolic gutter. That means the pus will move through right paracolic gutter into what? Into our pelvic region, right? Pelvic region. And what is this specific region called? This specific region is called recto-uterine pouch of Douglas. Recto-uterine pouch of Douglas, right? Now here it will form pelvic abscess, right? Pelvic abscess, and that pelvic abscess is now removed by what? It is removed transvaginally or it is removed transrectally, and we removed earlier transvaginally in this diagram, and that is what? Colpotomy. Colpotomy. So now moving forward, there is one important thing that we need to discuss, and the important thing is it is about Pringles Maneuver. What I'm saying is I'm saying about Pringles Maneuver. Now what is this? Pringles Pringles Maneuver, right? Talking about Pringles Maneuver. Now what is this Pringles Maneuver? Pringles Maneuver is the process in which we put our finger, right? We put our finger, where we put our finger is, we put our finger in, where? We put our finger in Epiploic Foramen of Winslow. Now why we are doing this? We are doing this because, as we know, the anterior boundary of what? The anterior boundary of our epiploic foramen of Winslow is what? Lesser omentum, and in that lesser omentum what we have is, we have what? Our DAV structures. Now what are these DAV structures, right? What are these DAV structures? The DAV structures are, right, our what? Bile duct, hepatic artery, portal vein. Now we are putting our finger into foramen of Winslow to pull out DAV structures, right? Since it is compressed, we are putting our finger and we are just pulling it up. What we are pulling? We are pulling DAV structures, right? Why we are pulling the DAV structures? So that we can clamp them, right? We can clamp them. Now why we are clamping? Because we are just performing surgery, or we are performing operation in that region, right? In that region, in lesser sac, right? In lesser sac, and we need to go through what? Epiploic foramen of Winslow. Now what we are doing is, we are just putting our finger in epiploic foramen of Winslow. We are just what? We are just pulling the DAV structures, right? And that, since that DAV structure will be raised, we'll just put a clamp right there. So you can see right here, okay, you can see right here it is clamped. What is clamped here? Hepatodurinal ligament is clamped here. Now hepatodurinal ligament, now what is this? Yes, we already discussed this. Hepatodurinal ligament is a ligament, or it is a part of what? Part of lesser omentum. And this hepatodurinal ligament, specifically it contains DAV structures. So we are just clamping DAV structure. Okay, now we'll clamp the DAV structures, but after 15 minutes we have to unclamp them. Why we have to unclamp them? Because we need to avoid ischemia, right? Ischemia. Liver may die because of excessive ischemia. So within 15 minutes we will just remove the clamp and intermediately we'll just perform this action. This is done when we are operating in liver, right? So that there will not be liver bleeding, right? Liver bleeding, that's why. Okay, we are doing intermittently, right? Why we are doing it intermittently? Because since we'll just block hepatic artery for a longer time, there will not be enough oxygen supply to liver and it may die because of excessive ischemia, right? Portal vein, it brings nutrition, right? Portal vein is there, it brings nutrition for metabolism in liver. Okay, now this is about Pringles Maneuver, right? Now we discussed this diagram, we also discussed this diagram. This is now our question. Which of the following is true about location of Omental Bursa? Omental Bursa, what is Omental Bursa? Omental Bursa is our lesser sac, right? Lesser sac, and the lesser sac is we have said that it is also a left subhepatic space, right? Left subhepatic space. Okay, let us move now. Left subhepatic, yes, that's right. Left subphrenic, no, we did not talk about this. Right, no. So the right answer is option number A. What is option number A? It is our what? Left subhepatic space. Okay, now moving further, what are the boundaries of epiploic foramen? Okay, following are the boundaries of epiploic foramen except. So here the free margin of lesser omentum. Talking about the boundaries of epiploic foramen, if you remember the anterior, what was the anterior? Anterior was our hepatodinal ligament that was containing what? Our DAV structure, right? Similarly, now posteriorly, what we were having? We were having T12 inferior inferior vena cava, right? Suprarenal also. Similarly, superiorly, okay, I talked about posterior we are having inferior vena cava, T12, right? Suprarenal, okay, and superiorly, what we have? First segment, and the first segment caudate, right? Inferiorly, what we are having the first part of duodenum. Okay, now the free margin of lesser omentum. Yes, the free margin of lesser omentum. The free margin of lesser omentum is called what? It is called hepatodurinal ligament, that is consisting of DAV structure. So it is the right answer, so it cannot be our answer. Inferior vena cava, yes, it is the posterior boundary. Quadrate lobe of liver, we said the quadrate lobe of liver, it is what? It is present behind the 4B. It is quadrangular in shape. So the lobe of liver, right? The lobe or the segment of liver that was forming the superior boundary is our caudate, right? Caudate, not quadrate. So this can be the answer. Let us move to another option. Right adrenal, yes, right adrenal suprarenal gland. So this is not the answer. So our right answer is option number C. So this is all about what? This is all about our peritoneal space and sac. We discussed about all these things. So that's all for this topic. Thank you.